Cardiac and pulmonary rehab are supervised exercise programs that help individuals with heart and lung conditions improve their health and quality of life.
We combine monitored exercise with counseling and education to help people recover from their cardiac and pulmonary event, manage their illness, and to adopt a healthier lifestyle.
I'm Jordan Findley, respiratory therapist in Cardiopulmonary Rehab.
And I'm Becky Linn, Cardiopulmonary Rehab Manager at Salina Regional Health Center.
Let's start out with the basics of what is cardiac rehab and what is pulmonary rehab and what's the differences.
Thanks, Mike, for having us. Cardiac and pulmonary rehab are exercise programs where patients are monitored. The monitoring that we do with cardiac patients is typically heart rate, blood pressure, but also telemetry monitoring where we monitor their EKG rhythm with the sticky patches.
Pulmonary rehab, we also monitor blood pressure and heart rate, but we pay more close attention to pulse oximetry, your oxygen level of your blood, especially if a patient's on oxygen. And we're trying to wean that sometimes. We provide education and counseling to help people live as healthy lives as possible. We work on tobacco cessation and diabetes education also.
Many heart and lung conditions are chronic, and you need to know how to manage that. And so because of that, one of the best ways we manage our conditions are to correctly take our medications. Pills are pretty easy most of the time. However, for some of the pulmonary patients, the inhaled nebulized medicines can be tricky. And in addition, oxygen is considered a medication, and oxygen can be very difficult for people to manage at first and figure out how to use. Research also shows that patients who attend cardiac and pulmonary rehab sessions have reduced hospital admissions, and that's a win for everybody.
Kind of take us through a typical session, when they come in to see you, or maybe talk about the stretch of sessions that the patients have.
It all starts with initial assessment. We greet the patient, ask them how they've been doing since they were here last, if they've had any changes, any concerns. Then we talk about what the plan for exercise for the day is. Then they start exercising. We have treadmills, new steps, bikes, arm bikes. We like to build up their stamina and get them working 30 to 45 minutes of comfortable exercise. They're usually here about an hour a day. Do group and individual education. Patients usually come for 1 to 3 months based on insurance guidelines.
Well, thank you so much for coming on the show and for everything you do, and thank you for watching. For more information, please visit srhc.com, like us on Facebook, follow us on X and Instagram.